Hello, I'm Regina McCann-Hess, President of Forge Wealth Management, and welcome to our Women in Wealth series. Today, we're going to talk about Medicare, and we are in the annual enrollment period for Medicare. So thousands, I guess hundreds of thousands of people over 65 are, looking at their Medicare insurance, seeing, do they want to continue with the plan they have? Do they want to look at a different plan? A lot of decisions are being made over the next couple of weeks to month or so. So that's the good thing. There's a lot of choices. The tough thing is, though, since Americans are living longer, that are also going to have to deal with higher healthcare costs. So, it's positive and it's also a tough thing to swallow, a bitter pill to swallow, I guess would be a good way to say it, that the healthcare costs are going to be a little bit more expensive. And, hey, we have been dealing with inflation for a couple of years now with everything else in our lives. And it seems like healthcare expenses and, have their own cost of inflation that doesn't really go away at all. And PwC did a study out of their Health Research Institute and are expecting the healthcare cost to rise by 7% in 2024. So that is a really big number. So that is why having the right Medicare in place can help keep your expenses manageable in retirement. And, healthcare is one of the most expensive portions of your retirement. So that is why we talk about it. It's such an important component of what you're dealing with on a day-to-day. However, Medicare's complexity can make it all seem somewhat confusing. Imagine being asked to put together a jigsaw puzzle without having seen the picture on the box first. I don't think I could do it. Even with the box, I think I have a little bit of a problem, but it's, a nice challenge. But that's not the kind of challenge you want when you're dealing with your healthcare. And that's how many of us feel as we begin navigating our options and planning for what's next. So let's just talk about some of the basics that everyone approaching retirement age should know about this important component of planning for your future. And the first is, what is Medicare? Medicare is, a plan that the federal government began playing a direct role in our healthcare with the 1966 launch of Medicare and, of course, its sister program, Medicaid. Now, Medicare's goal is to provide affordable national health insurance for older Americans. Who's eligible? If you're over 65 and you or a spouse has paid at least 10 years of Medicare taxes, and people younger than 65, of course, with qualifying disabilities and medical conditions may also apply. So what are the different parts of Medicare? Because that's where it can get a little confusing too. So there's Medicare Part A, and that's the hospital coverage. That's where, you have a hospital stay and there's associated services that would include your room, a semi-private room, of course, your hospital meals, general nursing care, skilled nursing care, care on special units, including intensive care, the drugs and supplies and equipment that are obviously part of an inpatient treatment, a long-term hospital care situation, hospital, skilled health care for homebound and operating room and recovery services. But don't take that, when I say long-term hospital care, that does not mean long-term care. That's a totally separate aspect, and Medicare does not cover that. So that's Medicare Part A. Medicare Part B, that's the medical coverage. That's where you pay a monthly premium for that coverage. And that's going to cover things that are services and preventative services, such as like clinical research studies, emergency ambulance services, durable medical equipment, mental health, second opinions before surgeries, limited outpatient prescription drugs, doctor visits, surgeries, and of course, lab tests. So that's all packaged within the Medicare Part B. Medicare Part C, that's the private insurance part, most frequently called Medicare Advantage. These are Medicare-approved health insurance plans available through private insurance companies. Now, those enrolled in these plans still have to enroll in original Medicare plans Part A and B, but their coverage comes from the Medicare Advantage. Most Medicare Advantage plans offer prescription drug coverage too. So, in addition, there are other private plans besides Medicare Advantage. Medicare Part C includes all the benefits of Part A and Part B, plus some of the prescription drug coverage that's included in any Medicare Advantage plans, plus any additional benefits. And that, of course, is going to just depend on the plan. Then there's Medicare Part D. This is your prescription drug coverage. So easy. This is one of the easier ones to remember, Part D for drugs. I like to keep it simple. It's also a federal program. It helps subsidize your prescription drug costs for Medicare participants who are enrolled in Part A and B, and some of those who have Medicare Part C with Medicare Advantage. This is also a monthly premium for coverage, but be aware how it will affect your other drug coverage as well. Some of the prescription drugs coverage under Part D include federally mandated types of drugs that are Part D plans are required to cover. There's also specific coverage, payment, and subsidy rules for each prescription drug plan. There's commercially available vaccines, and there's also drugs available by prescription for purchase in the U.S. Now, how much does Medicare cost? And that's it's really going to depend. As most insurance plans, you're going to pay premiums no matter which plan you end up in choosing. You'll also have deductions and co-payments and co-insurance. And that, of course, depends on the plan you select. Kind of very similar to the plans that you're used to as you were, employed or in the working world. Now, something to know that is what is not covered by original Medicare, which is Part A and Part B. You may be surprised to learn that most dental care, eye exams, prescription glasses, hearing services, routine foot care, and of course, what I already mentioned, long-term care are among the list of things that are not covered by Part A or B. Also, Medicare Advantage Part C typically does cover some of these services. Now, here's your question. When can I enroll? When you can enroll in an initial enrollment period, is your first opportunity to enroll would be Part A and B, and that begins 3 months before you turn 65 until 3 months after. So, it's a bit of a window where you can actually enroll for Medicare. Even if you still have employer coverage, you may need to apply for Part A, depending on what the situation is. And if you miss signing up, you can enroll in Part A and B or both by between January 1st and March 31st. The enrollment period for Medicare Advantage, which is Part C and Part D, is usually April 1st through June 30th. But to change a plan is where the annual enrollment program is. That is October 15th through December 7th of every year. And that's the area that we're in right now. Now, just be aware there are penalties for late enrollment or if you miss your initial enrollment period. So you definitely want to have a conversation with someone about that to see if that impacts you. What if I delay enrolling? So if you don't enroll in original Medicare Part A or Part B, it could cost you. For each year you wait to enroll in Part A, you could be charged an additional 10% for twice the time period you waited. For example, if you were 2 months behind, you pay 10% extra each month for 4 months. For each 12-month period you wait for Part B, you would pay 10% extra for however long you have Part B. If you're working beyond 65 and are covered by your employer's insurance, you may actually be able to put off enrolling in Part B without facing any penalties. So that's also something you want to talk to somebody about to make sure it qualifies what they call credible insurance for you to be able to delay that. Now, how does Medicare supplement insurance plans fit? Private insurance companies offer optional supplemental programs to help with out-of-pocket expenses, the usuals, deductibles, premiums, co-payments, for those of you still enrolled in original Medicare Part A and B. Now, this is different than Medicare Advantage Part C because it works alongside your original Medicare A and B instead of being an alternative. The open enrollment window for those supplemental plans, often called Medigap, begins in the first 6 months after you turn 65 or older and are enrolled in Medicare Part B. So make sure you enroll during this period, or you may not get accepted in some once those windows close. Now, how do you keep up on the latest developments in Medicare? Medicare.gov is actually a pretty decent website. You can get a lot of information from there. You can also go to Medicare, Twitter, which is actually now X. They have at Medicare.gov if you're on that app. Good luck to you. It's a little too much for me. And if you have other questions, you can also talk to your financial professional or an insurance professional that specializes in Medicare. But the simple action item is today, I would say, is just educate yourself on what the options are. What's the difference between Medicare A, Medicare B, Medicare, Part C, Medicare Advantage? And also going to Medicare website, you can also see some of the insurance companies that do participate in Medicare plans in your area. So just knowing or gathering the knowledge before you have to make those decisions is really going to help you. And with that, I want to thank you for taking the time to spend with me today. Again, I'm Regina McCann-Hess, president of Forge Wealth Management. My website is forgewealth.com. You can follow me on Facebook and YouTube at Forge Wealth. On Instagram, it's Forge Wealth Management. And on LinkedIn, Regina McCann-Hess. Have a great day.